Hello, my name is Brook Ward. I'm the President CEO of the Washington Health System. My honor to be back with you for our Friday video series where we attempt to update you on what's going on within our organization and in the environment around us. Usually COVID related, but not always. So a couple things for you this Friday. First and foremost, I hope you got a chance to see the video we put out 2 Fridays ago where we thank the community for your outpouring support we've received really since early March. We've gotten support from businesses, nonprofit groups, individuals, churches, etc. It's just been amazing. And so we did a video 2 Fridays ago just to honor and thank you for that. That was done in conjunction with Devin Allen Johnson from the Rough Creek Band. We had over 23,000 people view it. Hopefully you had a chance to see that. If not, you can see that on our social media channels or on our website. Now moving on to some other topics for today. First thing I wanted to talk about is the increase in cases we're seeing in our area. Going back to when we first started doing COVID testing here in this area, through this most recent time period, we were hovering around 1.5% of the people who came in for testing at our facilities positive for the COVID rate, and it was holding steady. In the last couple weeks alone, that's risen to 3.53%. So we are seeing an increase in the number of cases who are positive, and it's not due to just increasing tests. It actually is an increase in the number of people in our population who are positive. And so we want to keep an eye on that. Now, going back again to early March when this started to break out in the US, the most we ever had at any one time who had to be hospitalized was 2. And so we never saw that big surge in March or April that we expected. But that has been increasing as well. And so, for example, this morning we have 5 inpatients in-house who are confirmed positive COVID patients. Now, that's not alarming. We're prepared, we have the supplies, we have the precautions in place, and we can care for those people. And we're not seeing cases or situations like you're hearing about on TV in Arizona and Florida where hospitals are overrun. We're in good shape here, but it is increasing, and I want you to know that. One of the questions I've gotten recently is, with the numbers going up, are we prepared to care for these patients? And the short answer is yes. We did a lot of work in March and April to prepare for that surge that never happened, and we can use those lessons we learned then to apply now if necessary. And we're actually monitoring the situation just like we have all along daily to make sure that we're ready and can take care of people when necessary. Now, a few words of advice, and these are the simple things you've heard over and over again over the last couple months, and they're simple. Frequent hand washing. Remember to social distance when at all possible, and wearing a face mask and wearing it appropriately, covering your nose and your mouth. Now, I know there are lots of people out there who think they shouldn't and don't want to wear a mask, and I would highly encourage you to sort of rethink that perspective. It's a sign of respect to wear a mask. Not only does it protect you, but it protects the others around you. So by wearing that mask, you're showing them that you care enough about them to keep them safe. That's one thing. Secondarily, we do have a new executive order that came out last week that now mandates that everyone in the state of Pennsylvania wear a mask in public, including in outdoor venues. Now, I understand that that's not fun. I don't like it either, but I do it because it does help protect me and it helps protect you. And again, it shows a small sign of respect to people around you. And it's a small sacrifice to make. If you think about it, we make these kind of sacrifices every day without even thinking about it. We all wear seatbelts to help protect us if we get in a car wreck. If you're a smoker or you're not a smoker, if you're in a public place, we all expect smokers not to smoke in a public area so that we don't have to breathe secondhand smoke. Those are all examples of small sacrifices we do to protect ourselves and others. And so please, wearing a mask is important. I've also had people ask me, well, why should I wear a mask? It's not 100% effective, it doesn't work. Well, that's sort of a loaded response and question. Here's what I mean by that. Yes, the mask is not 100% effective, but neither is a seatbelt. You can still die in a car accident if you're wearing a seatbelt, but it dramatically lowers that risk, and that's why we all do it. The same thing applies for masks. It's not 100%, most things are not, but it does dramatically decrease the chance that you would get coronavirus or some other illness by wearing a mask. And there's science to prove it works. Surgeons have been wearing a mask when they do procedures and surgery on you for over 100 years, and they don't do it because they think it looks good. They do it because they know it works. And so please, again, this is a small sacrifice. We can help each other and our community by keeping the cases down by just doing these simple things. Social distance, hand hygiene, and wearing a mask and wearing it appropriately. Please do it. Moving on then to COVID testing. We are still universally testing people prior to procedures and surgery. We did talk about stopping that, but for now we're going to continue to do that. The turnaround tests vary from the time you get the results back. If we do it in-house and we have the capability of running about 70 COVID samples a day in-house, typically we can get those results back to you within about 3 to 6 hours, depending on when you come in to get it done. For all others that we have to send out to Quest, it takes about 24 to 48 hours. So the turnaround time is still pretty good, and that's been holding steady, thankfully. We still have our 2 drive-up locations where you can go and get a COVID test. The one is in Waynesburg at the Washington Health System Green. The other one is at our tent at the drive-up center at the Wellness Way here in Washington, Pennsylvania. At both locations, please don't get out of your car. We've had people who are getting out of the car coming into the facility. That puts all of us at risk. Stay in your car, we'll come out to you. Now you can help us here. One of the issues we have is, unlike what you hear on TV, not everybody can get a test anytime they want. We don't have enough supplies for that. We definitely have more supplies now than we had in early March, but it's not limitless. We don't have enough for everyone. And there's 2 ways you can help. First, if you come back from vacation, please don't come to us and ask for or ask your physician for a COVID test just because you were concerned you're on vacation. That doesn't meet the CDC guideline or any recommendations medically for getting a COVID test. It doesn't even make sense. Secondarily, employers out there, please stop sending your employees to us to get a COVID test when they're coming back from vacation. Again, that does not meet the CDC guidelines, and that doesn't prove anything. So for example, if they came back from Myrtle Beach yesterday and you want them tested today, it's going to show negative. It takes at least 5 days for the virus to incubate before it would show up as being positive. And the CDC doesn't recommend that anyway. So please stop sending people to get that test. You're wasting supplies. They're in critical shortage right now, and we need them for the people who actually need the test. So you can help us out in that way. And lastly, as I said, please remember, don't walk into our facilities when you're coming for a COVID test. We'll come out to you. Now, a couple other things here I'd like to talk about. If you're concerned about the increase in cases in our area and what that might mean for you, remember, if you're a patient of our physician offices, we can set up a televisit so you don't have to come in contact with anybody, and we don't want you to put your care on hold. Our facilities, both our offices, our hospitals, the emergency departments, are safer than any restaurant, grocery store, etc. that you're going to go to around the Washington and Greene County area. So remember to come in. We will care for you. But if you want a televisit, we can do that to help protect you. And then we've got the appropriate precautions in place in our emergency departments down in Waynesburg and Washington to keep you safe if you do need to come in. Last topic for today is a comment about the Wilton Wellness Center. With the new governor order that came out last week, it now mandates, including in gyms, as I said earlier, that everyone has to wear a mask in public, including outdoor spaces. And there was specific language in there around gyms and wearing masks in gyms. And so we at the Washington Health System, we're rule followers. We want to make sure we do what's right. And so we're going to make sure that our staff and you, when you come into the Wellness Center, wear a mask. And that includes in all settings while you're working out. The only exception would be while you're in the pool. Now, I understand people don't like that. I understand it's difficult to work out with a mask on. Believe me, I've tried it. I get it. But our staff at the Wilton Wellness Center will help you, and they can suggest modifications to your workout to make sure you can still get good exercise in while wearing a mask. But we are going to comply with the rule. Now, I've had a number of people argue with me already that the governor's mandate is not a law. And sort of the answer here is yes, no. You're right. It did not go through the House of Representatives and the Senate to become a normal law. But a governor's executive order has the same mandate, civil and criminal penalties as a law. It has the same effect as a law. And so it is a mandatory thing. It's not a recommendation. It's not a guideline. And so again, we're rule followers. We're going to follow the rules here. So you can help by wearing a mask. And again, I understand it's not fun. But if we all can work together to wear a mask, continue social distancing, continue hand hygiene, we can keep the number of cases in Washington and Greene County low. Because if we don't, there's a possibility we could be put in lockdown again. And that means the Wilton Wellness Center and many other businesses are going to be forced to close again, and none of us want that. So let's work together to keep our environment, our county, and our communities safe. Those are my updates for today. I hope you found them informational and useful. We'll be back next for our next video on July 24th. Please remember to tune in, and until then, stay safe.